The second shot would be exactly 35 days.
April 9th is Janet Van Der En's next scheduled vaccination after receiving her first dose of the Pfizer vaccine.
Actually, when we went through, there was a whiteboard there and it said your next shot will be April 9th. So they've got it right on the board. So no talk about delaying it.
As retired General Rick Hillier said yesterday, the delay between shots will begin on March 10th.
Groups of people who will get their second dose because it's too late to cancel them or not cancel, postpone their appointment out to further in the spring or early summer.
It all follows news this week that the National Advisory Committee on Immunization, also known as NACI, recommended going up to 4 months between doses. Today at a clinic in Hamilton, some are hoping that's not the case.
I want to get on time because I'm afraid that the reason why they are making it longer is just because maybe they're running out.
Ontario is set to follow the recommendations in extending the dose interval along with other provinces.
We can extend between the first and second dose. All that does is make sure that more Ontario residents get access to the vaccines.
The goal is to create opportunities to protect the entire adult population against the virus by early summer. NACI says its recommendations are based on emerging real-world data from places like Quebec, BC, Israel, the UK, and the US. New research shows both Pfizer and Moderna were 70 to 80% effective 2 months after the first shot. But these studies are not sitting well with some in the medical community.
This is not based on evidence, it's based on really an extrapolation.
VP of Science and Research at the University Health Network in Toronto, Brad Waters, is calling NACI's advice an experiment and says more clinical evidence is needed.
We'll be out there all alone. It's the only country that's out that far, spacing between the doses. And so that second dose, that re-exposure, creates a much stronger immunity.
Waters believes the decision is stemming from rising pressure to get needles into more arms as variants continue to emerge. Epidemiologist Tim Sly believes the rewards of the new distribution plan outweigh the risks.
That means that a greater proportion of people are now not going to have that first dose. They're going to have to wait, and that period of time now isn't something that we can juggle with. The variants are arriving daily, and any increase in time will mean an increase in illness and presumably death as well.
As for Van Der En, she says she has no issues waiting for the second shot.
Much rather see more people with needles in arms than less, just so that we can get on with life.
The top infectious disease specialist in the U.S., Dr. Anthony Fauci, also disagrees with the 4-month interval and is sticking with the 2-dose system spread only 3 weeks apart. As we mentioned yesterday, the province of Ontario says its plans to begin with the recommendations is this coming Wednesday.